Hi, I'm your host, Michelle James, Executive Director for the Providence Nursing Institute. As a reminder, the information provided during this event is for your informational purposes only. If you have questions around COVID-19 pandemic, please visit our website at providence.org or visit the cdc.org for their official medical updates. This event does not create a doctor-patient relationship, and any questions or medical advice discussed is not considered guidance on what you should do. For any medical questions, please reach out to your primary care or healthcare professional. Now let's begin. Joining me during this live event is Becca Bartles, Executive Director for Infection Prevention at Providence. I've had the privilege of working with Becca over the last 9 months, preparing and planning during this pandemic. The work has been hard, and I wanted to say thank you to all of our healthcare heroes and their steadfast commitment to their colleagues, their patients, and our communities. And Becca has led a lot of that work. So, Becca, thank you for joining. And can you please just tell us a little bit about your role at Providence and also about your background in infection prevention?
Absolutely. Thank you, Michelle. And I really appreciate the opportunity to come and talk to this group today. So I am an epidemiologist. That is my background. I've been a board certified infection preventionist for 15 years. And really what we do in the profession of infection prevention and epidemiology is we focus on reducing the risk of infection for individuals when they seek healthcare. And so whether that be in an inpatient environment, an outpatient environment, or long-term care settings, our goal is to create processes and protocols and other methods to ensure that you leave our facilities healthier and safer than you did when you came in.
Great. Well, and this year has put a real test to our epidemiologist and you and your team. And again, you've done such incredible work, and we're really grateful to you for that work. Can you tell us a little bit about the timeline for the COVID-19 vaccine? You know, we're hearing it in the lay press and would love to hear your thoughts.
Absolutely. And it's exciting that really the timeline is accelerated for healthcare workers because of the critical role that they play in caring for people with COVID. And so we are receiving vaccine as we speak. Today, we're expecting shipments at a number of our facilities. And we will begin vaccinating healthcare workers as soon as Wednesday of this week. So it depends on which facility you're at, because the state or each state is responsible for distribution. And so doses are arriving at a little bit different schedule in each state and based on each facility. But as soon as Wednesday, and I think as late for those that are in the initial group that will receive vaccine as late as maybe next Monday. So lots of vaccines in arms, hopefully later on this week.
Yeah, that's great. And can you tell us, Becca, just a little bit around the planning that's gone into really making sure that Providence has a good plan for vaccines, the COVID vaccine?
Yeah, boy. These last couple of months have been spent planning for the unknown because we got some word from the CDC back in September that gave us a picture of what we could maybe expect for vaccine rollout, and then a revised document later on in October that gave more details. But a lot of the questions have been unanswered at this point around how much vaccine we'll receive, when we'll receive it, who can take it, how we prioritize, et cetera. And that is all becoming very clear over the last few days as we get the emergency use authorization instructions from the FDA and Pfizer and the Advisory Committee on Immunization Practice recommendations. So, and as we awaited those sort of finalized documents and the finalized state plans, we wanted to ensure that we were prepared to be able to respond to whatever those requirements were. And so we've done a lot of work to try and understand risk within our organization and to identify those roles that are at highest risk of working with individuals with COVID, And those roles that involve the most patient contact overall, as well as contact with um, the environment and patient care areas and potentially contaminated materials. So that when we are ready to begin releasing vaccine, that we can really focus on the highest risk areas and individuals whose roles are considered the highest risk roles.
Yeah, thanks, Becca. It's been a very complex process and very fluid. And again, I think a real credit to the teams for staying focused and doing everything they can to say, we want to be ready to do the right thing for our heroes that have been on the front lines caring for patients, in addition to the elderly that have been hit really hard in some of the congregate care settings. So again, lots of really great work that's happened. Can you tell me, are there certain groups that are more susceptible to COVID-19?
Yeah, absolutely. And really, there's two groups that CDC considers to be critical populations. So there's those that are more at risk of acquiring COVID vaccine, and healthcare workers fall into that group. Individuals that live in congregate care settings or settings where a large number of people live together. And there's a long list of sort of other things that would put someone at higher risk: essential workers, folks that live in or that work in environments like schools and daycares, etc. And then there's the list of things that put you at higher risk for severe disease and possible mortality morbidity, and those are really focused on pre-existing conditions. And so there's been a lot of literature growing over the last few months to help us understand what those risk factors are. Things like diabetes, obesity, smoking, and a long list of other underlying health conditions. And so that's part of the reason that the vaccine is being rolled out in waves. Because we won't have enough vaccine to vaccinate all Americans within the first couple of weeks. It's going to take a few months to get there. So those high risk populations really make up the first group that I spoke about. Healthcare workers and those living in long-term care settings will be the first group to receive vaccine, and then that other group that I spoke about will be the second group.
Great. And that timeline, can you just kind of give us a timeline in weeks to months to really, when we'll really get kind of to that herd immunity, that area where we've got enough people vaccinated?
Yeah, it's hard to say. It's a bit of predicting the future, but I think if we have good uptake and, folks in our community, if Americans are accepting of the vaccine and we have good uptake initially, it could be very soon. It's going to take a while to have enough doses available to vaccinate everybody that wants to be vaccinated. I think that likely by the end of the year or very early in 2021, we'll have been able to get through the majority of what are called the phase 1A caregivers, which is healthcare workers that have direct contact with patients or work in healthcare environments. So likely by early January, that will be complete. And then I think we're looking farther into the summer, probably before we have enough vaccine to vaccinate folks that are not in critical populations.
Great. Another question is, if we get a flu shot, does that protect me from COVID-19?
Oh, I wish it did. This would be so much easier if it did.
Yeah.
It doesn't, but it does protect you from flu, which is important because although we're not seeing a lot of flu, there's still some flu, and a COVID-19 / flu infection together would be a very bad thing. So that's obviously something we need to avoid. The other scenario is flu symptoms mimic COVID symptoms and vice versa. And so that can really be problematic for oh goodness, I'm sorry. My laptop. Oh my goodness. There, got it. Oh, apologies. My screen went dead.
That's the way it goes these days on Zoom, right?
Absolutely. Goodness. Oh, and I've lost the thread on
Flu. Protection, yes.
And we're in critical staffing right now, so we need as many healthy healthcare workers working in our facilities as possible. So we encourage everybody, get the flu vaccine, and get the COVID vaccine, and that way everybody can be at work and we can be caring for COVID patients until we have enough vaccinated in the population for herd immunity.
Great. And it's not too late to get a flu vaccine either. People, they're still available. We really encourage people, if you haven't had one, consider getting a flu vaccine. That's great. What side effects are there if we're to get the vaccine? What should I be worried about, if anything?
Sure. There are some relatively mild side effects reported. So pain at the injection site being the most common, which is pretty common for any vaccine. A low-grade fever, fatigue, muscle aches, etc. And what's problematic for us is a lot of those things are also early symptoms of COVID infection. And so, we want our caregivers to be really mindful if you're receiving or when you're receiving your vaccine. It's probably a good idea to do it right before you're planning to have your days off, so that if you do develop some of the minor symptoms, it won't be necessary to miss work because of concern that you may have COVID. But if you do develop those symptoms, it'll be difficult for us to tell the difference between a vaccine reaction and COVID. And so you'll want to follow the normal caregiver health processes and notify your core leader.
Great. Thanks, Becca. Has the COVID-19 vaccine been proven to be safe and effective?
Yes. So the Pfizer trial, and I'm talking specifically about the Pfizer vaccine that received FDA emergency use authorization on Friday. The Pfizer trial had 36,000 participants, which is a lot for a vaccine trial that happened in just a short period of time. The vaccine showed 95% efficacy, and so those vaccine trial participants were broken up into two groups, 18,000 in each group. And you can see there's a graph that Pfizer puts out that shows as these folks went back into the community, those that received the placebo began to develop infection, and the graph shows that curve sort of rising. And then those that received the vaccine did not. And so there's a flat line across the bottom. And as those two diverge, it just becomes abundantly clear how effective this vaccine is. So that's very exciting.
Yeah, and that's really unheard of. When we think about the vaccine, to have a 90% effectiveness rate is pretty incredible when you think about it. So that is exciting for our communities. And because you talked about just the Pfizer vaccine, there's a question about, can you talk a little bit about the difference between the two vaccines that are coming out, the two that we know of? We know there are others on the horizon, but the Pfizer and the Moderna, can you give a little information?
Absolutely. So both are mRNA vaccines, which is different. We don't have other mRNA vaccines that we routinely use. And the Pfizer vaccine was, as I said, it was approved first. The Moderna vaccine is on the same track for approval, and maybe a week or two behind the Pfizer vaccine. The doses that are coming out in the Pfizer vaccine will be less. And once Moderna is approved, we should see a much more rapid distribution and a lot of additional vaccine release. So that's very exciting.
Yeah, that's great. And the vaccines are not interchangeable. So I think that's, again, when we talk about complexity, it's something that I think is really important for people to understand.
Yeah. Unfortunately, they're not. And so if they're both 2-dose vaccines too. So if you receive the Pfizer vaccine 3 weeks later, you'll need a second dose. And it's not interchangeable with the Moderna. And then the Moderna, I think there's a 4-week interval between those 2 doses.
Yeah. So again, that important part of, I think, all of us making sure that, we're following our state and our federal guidelines, and making sure that, we're really, I think, again, the planning that's happened, and that really deliberate planning to say this is complex, but it's really important for our communities to know that we have really good planning in place. So there's another question that says, are there age restrictions for the COVID-19 vaccine?
Mm-hmm. So the trials did not include children, and so the vaccine is approved through this emergency use authorization for folks age 16 and older. And over time, obviously, there will be additional information, additional data, and other populations. But for now, it's just basically adults.
Great. Do you want to talk a little bit about some of the information that you've learned around pregnant women and lactating women?
Mm-hmm. Absolutely. And
Great.
we're waiting for the final recommendations from the advisory committee on immunization practices, which is a subgroup of the CDC. And they release sort of with every vaccination, all the ins and outs and do's and don'ts. And so that's forthcoming. But the advice to date is that pregnant women will be allowed to receive the vaccine. They'll be allowed to choose to take the vaccine. But because pregnant women were not included in the studies, there's still an element of unknown. The technology itself is not doesn't appear to be high risk, but without those trials, it's difficult to know. And so it's recommended for both pregnant and lactating women that if they'd like to receive the vaccine, they should just have a conversation with their primary care provider and ensure that they do that risk benefit sort of exercise with them.
Great. And Becca, a question that came through, can you talk a little bit about define what mRNA means? Abbreviations, we've got to be careful.
Right. Yeah. I'm probably not the best person to give you the very detailed sort of description and explanation of an mRNA vaccine. There's lots of immunologists and pharmacists on our staff that may give a much better version of the explanation than I could.
Great. Well, and I guess what we can say is that mRNA, the messenger RNA, that it actually helps with the antigen, so the body to actually promote an immune response so that they actually get some immunity and avoid becoming ill when they get the vaccine. So I think that's important as the immune system is reacting.
Right, and it's not it's not live virus, and that's part of the nature of the vaccine is an mRNA vaccine cannot cause you to become infected. There's no risk of infection. It basically just teaches your body how to fight off the actual virus itself.
Yeah, great, thank you. We know that there's a limited supply of vaccine. And we've already talked a little bit about this, about who will get the vaccine first and the tiers. So I don't know that do you want to just highlight that one more time and then we'll move on to the next question?
Yeah, I think, all indications, again, are that we should have enough vaccine over the next few weeks to vaccinate all of our healthcare workers that fall into the 1A category, which is those that have direct contact with patients or with potentially infectious materials in the healthcare environment. Because we won't get enough doses this week for all caregivers, and because it's going to take us a bit of time to to sort of get everybody through that process, we are beginning that process in smaller groups. So within each facility, we've identified what are the highest risk work areas and the highest risk roles for being in contact with individuals with COVID, and those folks will receive emails first with information about scheduling, and then each cohort will receive information as we get additional supply and additional space in the clinics opens up. And that is going to that happens for us through the vav.providence.org tool. And so I would really encourage everybody to go to that website if you haven't already and complete your survey. It allows you to tell us your preferences for how you would like us to communicate with you, whether it's email or text, and you can make sure you've got the right email and the right phone number in there. And it also allows caregivers to self-assess their risk. So we've looked at each ministry, each facility, each department, and try to understand risk there. But you guys know your risk better than anyone else. And so we really want you to share with us that if there are unique things about your role or your work location that it's important for us to know. That tool allows you to do that, and it's a great way to give us both that information and information about if you're interested in vaccines, so that we can make sure that that we're reaching out at the right time to your right communication preferences.
Yeah, thanks, Becca. And I just want to be really clear with the audience that that is a specific Providence tool that we're using across our system. It is not every other healthcare. If you're in a different healthcare setting, there are different methods that organizations are using around that planning. But I guess I want to just highlight the importance of what Becca said, that people know themselves best, and when you have that opportunity to do that self-assessment, that helps you make those decisions around when it's the right time to get the vaccine if you feel like you're in a high-risk category. So I think it's really important, that self-assessment piece. So thank you for that, Becca. I want to just, another question that came out is, once I get vaccinated, can I stop wearing a mask and social distancing? I'm going to let you give the best news.
I wish that was the case. I wish that was the case. Unfortunately, no. And we're going to continue to need the masks and the social distancing until the pandemic has ceased. And that will be around the time where 75 to 80% of our population is immune to COVID. We can either get that immunity through natural infection, or we can get it through vaccination. And I'm very much hoping we get it through vaccination, and we get it quickly so that we can all put away these masks and begin to hug our friends again.
Yeah, that's great. Yes, I'm giving you a virtual hug right now, yes. Becca. It has been probably one of the hardest things, but really, when you think about simple things that we can do to protect ourselves and protect our loved ones and our communities, it is that social distancing and masking, hand sanitizing, making sure that we're really and cleaning spaces. Those things that from an infection prevention practice, I think have been in place for a long time. It's just been kind of escalated to a level where it's not only happening in hospitals now, we need it to happen in homes and, in stores and everywhere else, just to help make sure that our communities are safe.
And this, this is something we may take away from this pandemic that allows us to be safer in the future. With flu seasons and respiratory season every year, we have tens and thousands of individuals that die from respiratory illness. And so I think we're all learning more about those tools that we can use to protect ourselves, and hand hygiene is at the top of that list.
Yeah, and it's unfortunate that a pandemic has had to get us to the place where we all understand the value of washing hands or using hand sanitizer, but it's one of those lessons that I don't think we'll forget for a very long time. So
I agree.
Yeah. Are certain people more susceptible to adverse reactions to the vaccine?
So individuals that have had severe allergic reactions to any of the vaccine components and in the past are at higher risk, and those folks should not receive the COVID vaccine.
Great. Okay. And then another question about what types of vaccines and how are they stored? You've talked about Pfizer and Moderna, but can you talk a little bit about how they're stored?
Sure. The Pfizer is a really tricky one. It requires ultra cold storage, -70 degrees, and that's not easy to achieve. And so we have ultra cold storage freezers strategically placed around our organization that allow us to keep that vaccine in the frozen state. And that's really sort of what makes it difficult, is it needs to stay frozen until very near the time that it's going to be administered. It has to be mixed, diluted, and then its shelf life is very short after that. The Moderna has a little bit better stability and doesn't require such intense cold storage requirements. And so while it's not something you can just leave on the counter for weeks at a time, it's definitely easier than the Pfizer vaccine. So you'll
Great.
see in most healthcare systems that the Pfizer vaccine will be generally administered from sites like hospitals. Because of that, we've got to keep it close so that we can abide by those storage requirements.
Great, thanks. And Becca, another question is really around security. We saw early on in the pandemic where there was a lot of black market around PPE and can you just talk a little bit about the planning that's gone into really security for our vaccine?
Absolutely. And like anything, I hate that we have to plan for security, but we want to be sure that that we don't lose any of this incredibly valuable vaccine, and that our caregivers are able to access it. So there has been quite a lot of planning, both in where the vaccine will be stored and in the process of the administration of the vaccine to ensure that it's behind lock and key. There's eyes on the vaccine at all times, and that we don't put this really valuable supply at risk.
Great. Thanks, Becca. And I think one last question is, will every age group get the same dose of vaccine?
For now, because we're just administering to 16 and older. Over time, there may be differences for pediatric and maybe even older populations as well.
Great, thanks. And I think that just highlights the fluidity as we're learning and as things are coming out, that there will be more information. We will, as a learning organization, I think we will continue to learn and we will continue to share some incredible work that's happened. So we're getting close to the end of our hour, half an hour. Becca, is there anything that you'd like to say before I close our session?
I would really like to encourage folks to take the time to read about the vaccine, to do the homework, read the literature. There's a ton out there on the FDA site and the CDC site that can help you to make a decision or to arrive at a decision that is informed. And I think that's going to be really important. We have the capacity to stop this pandemic in its tracks if we have good uptake of the vaccine. And all evidence to this point is that the vaccine is safe and effective. And so I'm very hopeful that folks will take the time and that we'll have the vaccine will be widely embraced by our citizens. So
great. Well, I'm getting the vaccine. How about you? When it's my time?
Absolutely.
All right.
Absolutely.
Right. Great. Well, I want to thank you, Becca, for joining today, and for everyone for listening and sending your questions. To learn more about our initiatives, programs, services, and ways to give, please visit psjh.give.providence.org. If you're looking for help or medical advice, please visit providence.org. And make sure you follow us on social media at Providence Health System on Facebook and Instagram, and under @Providence on Twitter. And I want to say thank you so much. Have a wonderful day. Stay safe. And again, it's just been an incredible privilege working with Becca. And thank you for sharing your expertise on Vaccines 101.
Thank you for the opportunity.
Great.